Hi everyone, thank you back to Nico the Vet channel for another installment on discussing the ailments and conditions which affect cats and dogs commonly. So today I thought what we might tackle is bloat in dogs. It's a term familiar to people who have experienced it and people who live in fear of it. It's not the only term, however, so we talk about bloat. The technical term is probably gastric dilatation, and in the most severe and worst case scenario, you could end up with gastric dilatation and volvulus. So what does that all mean? So what we mean by bloat or gastric dilatation, remember gastric just means stomach, dilatation means it's dilated, and bloat sort of infers an accumulation of air. So technically they're both correct terms because the net effect is that your stomach fills up with air. So your stomach, think of it as just a bag whose job is normally to receive food. As that bag fills up with air, and we'll get into why that happens, it fills up more and more and more and more, and we would then call that bloat or gastric dilatation. Then the next worst case that can happen is once it's filled up with air, imagine it like a candy in a wrapper. Once it's filled up with air, it can twist itself, so you end up with this candy effect with the two twisted wrappers on either end, and that's called volvulus, which is just a fancy word for being sort of twisted over. So let's start at the beginning. What sort of breeds of dogs should we look at? To consider the increased risk of this problem? It's not really. It's not a cat problem at all. So I'm not going to include cats in this talk. So the dog breeds prone to bloat or gastric dilatation, and I'm going to use the terms interchangeably, are typically what we call the deep-chested breeds. So what do I mean by that? Think of a deep-chested breed as being something like a German Shepherd or a Great Dane or an Irish Wolfhound or a Bloodhound. So you've got these, first of all, there tends to be bigger dogs who do this, so bigger than sort of a Border Collie size. And then it's most prominent in a dog with a very deep chest. So as they stand sort of this way, looking at you from the top of the back to the bottom of the breastbone, the more space they have, the more they're at risk of this condition, for a variety of reasons. So if you have a high risk breed, just be cognizant of this. At the end of the talk, you'll know what signs to look for. If you see the signs or you suspect the signs, these cases don't keep. These cases will kill you. So we need to identify them quickly, or we need to correct them quickly. So going back to what I said earlier, so effectively what we mean by bloat or gastric dilatation is that the stomach fills with air. And there's been some sort of changing or evolving opinion in terms of our understanding of this problem over the years. So originally what we presumed was happening was that in the modern world, where we stopped feeding dogs sort of meaty bones and meat and table leftovers, so on, with the advent of commercial proprietary dog foods, these are all biased towards sort of wheat and grain-based foods. And so there was a consideration that maybe what's happening is we've switched dogs onto eating these grain-based diets, which is arguably not a normal part of their diet. So all these grains go in there, and grains like to ferment. So you end up putting a lot of grain into the stomach, which is effectively a fermentation chamber. It sits there for a few hours. It starts fermenting. Fermentation gives off gas. That gas fills the stomach with gas, and you end up with a bloated stomach. So for years we thought that's what it was. So our guidelines were take care with feeding the dogs. So perhaps feed them smaller portions more often, so there's less potential for this fermentation process, or feed them different foods altogether. But some research was done several years ago now, where they took the dogs suffering from bloat and they harvested the air directly from their stomach, and they sent it off and had it analyzed and said, what is this air? Is it a fermentation product, or what is it? And it came back as it's not the fermentation gases that have come away from the grains in the food fermenting in their stomachs. So that we put that idea to rest, and it turns out that it's just regular air, as in sort of the air around us. So the conclusion there is, okay, so you filled up with air. How did you get air in there? You're clearly swallowing the air in, which we all do all the time. Once you've swallowed air in, not to put too fine a point on it, you either burp or you fart it out. So there's one or two ways of getting rid of the air, but it certainly can't stay there. And we all do that very efficiently, which is why none of us are sort of blowing up with air in our stomachs at the moment. So for some reason we don't understand, we have a dog who's been, again, just to be a bit banal, who's been burping and farting very efficiently their whole lives, which has been getting rid of the air in their stomachs. For some reason, that given individual on a given day, at a given moment, will somehow just lose the ability to do that and decompress the air from their stomach. They then start accumulating the air in the stomach, and they become anxious because that's painful. Think about when you've overeaten, your tummy hurts. So they start to become anxious, and they breathe faster, and they end up swallowing more air, which they again can't burp or fart out, and then that just accumulates more and more and more, and the stomach just starts to blow up like a balloon. As I said, it's painful, and the more it blows up, the more painful it becomes, and the more anxious the dog is going to become, and the more stressed they're going to become. So think of the stomach as it sort of comes, so your mouth, you eat your food, it goes down your esophagus, which is the swallowing tube. It goes through your chest, and it ends up at your stomach, and it sort of goes into your stomach here. So your esophagus goes into your stomach's just a great big bag, and then it comes out of the stomach, all the food ends up in the stomach, and then the food moves out of the stomach about here, and it goes down your intestines, and you digest it. And think of the stomach sort of as a big bag then, which is attached at this point and this point, so it's almost like a big hammock. It's in a big sort of sling, and you've got the stomach floating around in your abdomen. So there's a fair amount of movement, and normally when you eat it expands sort of this way, because remember this point and this point is fixed. So what's happening is you're swallowing air, it's coming in through the esophagus, it's going into the stomach there, and then for some reason you're unable to burp it back out, or it's unable to move forward and pass out the other end. So it gets bigger and bigger and bigger and bigger, now there's some substance to it, and it starts to move, it starts to rock like a hammock in the stomach. If it then manages to move so far that it goes over its breaking point, and it slips over literally like a hammock going over. So remember, it's attached there, and it moves as you move. It moves, and then suddenly just bang, it goes over and it twists. What's happened at this point and this point now is effectively, for it to go over, they've twisted like that. I don't know if that demonstrates the point. The problem is now it's gone up and it's gone over. Now you've got this great big bag which is twisted off at the esophagus end, and it's twisted off at the intestinal end. Not only that, to make matters worse, attached to the stomach floating around, there are some blood vessels that come off about here, and they attach to the spleen. And think of the spleen as just a great big spongy sort of tissue which is full of blood. It does have some weight to it, and then as the stomach flips up and over, it can pull the spleen with it, which twists over. And then the same thing happens to the blood supply to the spleen. It gets twisted off. So now you are in dire trouble. You are going to die if we don't fix you with this. And that's called the volvulus, when it's twisted over. So you've gone from just being bloated to being bloated and twisted, which has just compounded your problem, because if you had any chance of burping or farting that air out, you no longer do, and you are now a medical emergency. The dogs will do what they can. They are aware that whether there's bloat or volvulus, and I'm just going to use them interchangeably, the net effect is the stomach is dilated, and they are feeling extremely uncomfortable. It's painful, and they're aware this is going on. So they're doing anything they can, which is to try to vomit, try to empty your stomach, get rid of the gas via vomiting. And you'll see these big guys sort of heaving again, just putting a whole body retching and vomiting attempts into it again and again and again, and just nothing is coming out, and they're becoming more and more distressed and weaker and weaker and weaker. I remember someone described it very nicely to me on the telephone once, when they phoned and said, "My dog is mooing like a cow." So your inclination is to dismiss that as the words of a madman, but actually it's a very good description, because the dog is so desperately trying to get rid of it. He's going, and he's just desperately trying to get rid of this gas distension in his stomach, and they just can't. And these are emergencies. So when I get a phone call like that, I say to people, you need to come down now and you need to run, not walk, because as the stomach blows up more and more and more, the obvious effects are there's a limited amount of space inside of the body. So again, being a deep-chested dog, you have a lot of space, so that allows the stomach in the first place to dilate, and also it allows it the room to flip up and over. So you now find yourself in a situation, it's blown up completely, and although there is more space in these deep-chested dogs, they were never designed to have a stomach full of air. When I say big, I mean big. I mean virtually as big as my chest. It'll be absolutely enormous. And if you wonder that it's happening with your dog, so vomiting is the one sign. The other is, look at their flanks. So sort of down here, if you look at their flanks, if you look at the dog from the top, they should have their chest and then a waist and then their hips. That waist goes, and their flanks go out and out and out, and it literally looks like they've swallowed a beach ball. It's massive. And if you flick it or you ping it like that, it sounds like a drum. It resonates like a drum because it is a drum, because it's full of air. So as it expands, everything else is pushed out of the way. So one of the things that everyone thinks about is, yes, it's pushing up against the lungs and it's compressing the lungs, it's pressing up against the chest, and that is compromise your breathing, which absolutely it is. But the thing that's going to kill you is as it expands more and more and more. Take a quick sort of divergence. How does your circulation in your body work? Think of it really as you get the heart and the blood vessels. And if we simplify that into saying, well, we have a great big pump which pumps fluid into the vessels. The arteries go and feed the rest of the body, and then it's all got to sort of come back and then come back through the veins back to the heart to be pumped again. So we've got this sort of round and round system of a pump, tubes, and blood going round and round and round. But so the important point is it has to come back to be pumped again. So as the stomach is dilating and dilating and dilating, the big vein in your abdomen, in your belly, that brings the blood back from your legs and from your abdomen, basically everything from here down, is called the caudal vena cava. It's a big vein bringing everything back. And as the stomach stretches and stretches and stretches, the vena cava, which is here, like that, just gets squished closed. So now, not only have you got the pain of your distended stomach, not only are you struggling to breathe because it's pushing on your lungs, but now also your blood supply has been cut off, because your heart's still pumping blood forwards because that's a high pressure system going out, but it's not coming back because that's a lower pressure system coming back, and that's more susceptible to being squished closed on the vena cava. So now you've basically run out of blood because it's all ended up in your legs and in your belly, and it's not available to go to the rest of your body, and your blood pressure is going to plummet. And what kills you most commonly in these cases is cardiovascular shock, because the blood is just not getting around your body and it's all pooling in the back end. And that's why these cases are medical emergencies. So the first thing we want to do with these guys is decompress them. Just get that air out to stop it squashing the lungs, yes, but even more importantly, the big vessels, the veins, bringing the blood back to your heart. So we get this blood back in play. So it's going back around the body, feeding the brain and the rest of the body, and feeding the heart itself. So the first thing we want to do is decompress. You can do this various ways. You can take a big needle in through the flank, through the side here. You literally hear it go psh as the air comes out. It's not going to fully decompress, but it's at least going to take some of that pressure away. Probably you're not going to have needles like that at home. These are just ordinary injection needles. The other thing we do is we pass a great big tube. So we just open the dog's mouth, shove a tube, literally I normally use a horse tube, like a horse tubing tube, push it down their throat, get it down to the stomach, push it into the stomach, and you'll hear psh as the pressure releases, and you'll see their tummy going down, and the dog will give you that look like, oh, thank you so much, because they're feeling so much better. But that's the immediate life-saving throw, is decompress these guys. The second thing is you've probably not completely decompressed them, and remember they are in cardiovascular failure now, because the blood is all pooled elsewhere, so they just don't have the volume going around, and their blood pressure is in their boots. So after the immediate life-saving thing, like 60 seconds or less later, you want to get fluid into these guys. So we put a drip into them. Often we put a drip into both legs if it's a really big dog, and we'll just run fluid into them. What we're trying to do is add volume back to the system, because remember, the circulatory system is really just a pump, a bunch of pipes, and some fluid going round and round and round. And if you've had all this fluid sequestered in the lower part of the body, we need to give you back fluid, so your heart's got something to pump around the pipes. So we put fluids intravenously, and we put them in fast to fill the veins with something, just to get the circulation going again. Now, what to do from there? So very often these guys will get lucky. So we'll intubate them. Or how do you make the diagnosis? If you get to the vet and it's the obvious case, well, we've got the diagnosis and we've got it there. Other cases with the really big chests may be distending quite substantially, but not so much so that you actually have yet seen the flanks go out massively. So your vet will often say to you, I just want to take a quick x-ray. We lie the dogs on the x-ray, we take an x-ray, we look at it, and we see this huge big chamber of just air in the front of their abdomen. That's the stomach full of air, and we can often get a sense of if it's just a big ball of air, that's okay. If it's a twisted stomach, then we're going to see almost like what looks like two big air chambers, and that tells us, oops, you've twisted on top of it, so you've made your problems worse. So sometimes we will get lucky. Sometimes we will put the tube in and we'll decompress you, and we'll get lucky and the stomach just decompresses and it had never twisted. Other times we will get lucky and it was a bit twisted. Remember, we spoke about that flip over, and as it decompresses, it's flipped over there. As it decompresses, it just goes plop, and you get lucky and it's back in position and you're absolutely fine. So those cases, if we confirm that on the x-ray and we have a look and everything looks hunky-dory, we may well say, right, we're just going to monitor you intensely for the next 24 hours. Some people will even pass a nasogastric tube. So remember, it goes typically it's designed to feed you. So it goes up your nose, down your esophagus, into your stomach. And in these bloat dogs, it just gives us a pressure release. So remember, if they're still unable to burp after the event, at least they've got this tube coming out, giving us a bit of insurance policy while we're monitoring them for the next 24 hours. But really, the vast majority of these dogs are going to end up on an operating table because we just sometimes are not satisfied that the stomach either never twisted in the first place and we've successfully decompressed, or that it has untwisted or derotated. And even if it has done that, there's often an anxiety about remember, the spleen is attached to the stomach. Did that get dragged over? Did that get twisted or torn or blocked? Have you ripped something in your stomach? Sometimes if the stomach has been twisted, remember with this effect of the sweet wrapper, you've cut off the blood supply because the blood vessels run in the wall of the stomach. So you've just done that to all your blood vessels. So they haven't been able to feed the stomach, and sometimes substantial parts of the stomach, which is just a big muscly bag, sometimes substantial parts of those, the blood supply has been cut off for a long time. And because they've been oxygen starved for so long, parts of the stomach wall will actually die out, and we need to cut those out. So really, the majority of these dogs do end up on an operating table, if not immediately, within 24, 48 hours of the event. And what we're going to go do, surgically wise, is we open the tummy up right from the breastbone right down. So it's from the breastbone right down to the bottom there. So we open them up, have a look inside. A, confirm that the stomach is not twisted. B, confirm that the wall of the stomach is happy. It's well perfused. There's been no compromise to the blood supply. If there has been, we've got to remove those bits and close the tummy. Don't worry about that. Just like people who've had that sort of surgery for bariatric surgery, for eating too much, over time your stomach will re-stretch to the size it was. If the spleen has gone with it, that's a headache for us because the blood vessels have twisted, and remember, the arteries are pumping blood into the spleen, but the veins haven't let them out. So you've built up a lot of sort of deoxygenated, call it toxic blood in inverted commas, because it's bad blood now. It's been sitting there for too long. So you have to remove the spleen at the same surgery, and you want to remove that spleen without untwisting it. If you untwist it, all that bad blood goes back into your circulation with all the toxins that have accumulated, and that of itself can kill you. So really we want to do the surgery to check all of those things. It used to be very high risk surgery, so a significant number of these individuals would die before, during, or after the surgery. But as we've become more au fait and basically just better at it, the mortality rate has gone down. I would really optimistically say 90% of these dogs who present as an emergency, you would expect 90% of them to survive. So sadly, if you flip that around, that means 1 in 10 will not survive. What's also frustrating is, for reasons I don't understand, this condition typically happens in the dead of night. So we tend to see these cases between about 11 o'clock at night and 3 in the morning. And usually you, the owner at home, are woken up by this dog's desperate attempts to vomit, trying to get it out, and this mooing like a cow, and this very, very distressed dog. And it's, like I say, it's a terribly unsociable hour. You're tired, you're fed up, you had a long day, tomorrow's going to be a long day, and you think, oh, maybe I should just see how this goes. Don't. Get on the phone, wake your vet up, poor chap or lady at home, but the dog's needs are greater than that. So wake them up and describe exactly what you're seeing to them. And frankly, if there's any suspicion, because it may just be an upset tummy, so it may not be that. But if that vet in talking to you goes, oh, I'm not happy with this, or if you're just not happy with this, insist this dog must be seen. And if we see them and we go, oh well, it's not, you haven't swallowed a beach ball, it doesn't look that massive, before you go home, take an x-ray. We need an x-ray to see how you're doing. So they tend to happen at the most ungodly hour, don't try and sleep through it and think the dog will be fine till the morning. Go have a look at them. You don't have to particularly worry about this maybe in the smaller dogs. I don't think I've ever seen it in a dog smaller than sort of a small Labrador size, but it's the bigger guys. They are very much at risk of this condition. So how do you prevent it? What can you do to prevent it? The thinking used to be, like I say, feed your dog small meals, or try and avoid the grain diets. Does that make any difference? Probably not, now that we know that it's not a fermentation gas that's accumulating. But I think it's still prudent advice anyway with larger breed dogs, is to feed them 2 or 3 smaller meals throughout the day. Also, the advice used to be feed them from a height to stop them swallowing air. I don't know if that's ever been proven to be accurate, yes or no. I tend to do that. I have a large breed dog myself, just because, frankly, even if it doesn't help, it's not gonna harm either, and I'm at least covering a possibility. But is it proven to make a difference? I'm not convinced it is proven. The other advice was don't walk them within a half an hour to an hour of meal. Again, the premise being, if that's your stomach, your esophagus comes down there, your bowels come out there, you've just had a nice meal, so there's some weight to your stomach, so it's pivoting and on a sort of a hammock effect, it is swinging. And the theory is that if you've got this food and you've got in the tummy and you've got all this space, because it's a large, deep-chested breed of dog, this stomach, again, as you're trotting along, will do this, and you're increasing your chance of the twist over. So has that ever been proven to be definitively critical? I don't think it has, but it makes sense. So it's another thing I just do with my large breed dog. I've got a wolfhound. I wouldn't take her for a big run within an hour of a meal, and I try and sort of measure her meals, and I feed her from a height. Doesn't make a difference. Like, again, I can't say it, hand on heart that it does, but it makes sense. So let's take all of these precautions. And also remember that there's a distinction between just getting the bloat, the stomach full of gas, and the volvulus, which is the twist complication on top of the bloat. So a lot of times if we've had an individual do this and we've gotten away perhaps with a decompression, there's a school of thought that's saying maybe we should go in preventatively and stop these dogs from being able to twist their stomach around. So what do I mean by that? Is, again, it's a sling, so it's attached there and there. The rest of it just flops around. We can do an operation where this is your body wall now, so everything sits, I can't get this right on the camera there. Everything's sort of sitting in the body wall, so this is the muscle of your abdomen going around. What we will actually do is stitch the stomach to the body wall. So you've still got the sling effect here. So you've got the stomach sitting like that. It can still bloat. So if you eat too much, the stomach can still dilate full of gas. But if we've stitched the stomach to the abdominal wall, your abs, it can't twist over. It can't do this flip and volvulus because you've tacked it down there. Yes, hypothetically, if there's enough force, it could rip your anchor, your suture that you've put in there. It could rip that free and still go over in a volvulus. But if you've done the appropriate surgery, which is where you literally raise a flap of the stomach like this, and then there's the stomach wall, and we actually put it around the stomach wall and back onto the stomach. You've literally just, I don't know if you can appreciate that, you've created this loop effect around there, and now it's going to have a hell of a job to go, because it's actually a flap of stomach here stitched around the abdominal wall there, and it's going to have a lot of job rotating. So that's preventative. All that prevents is it prevents the volvulus, it prevents the twist. It does not prevent the bloat. So we're just trying to prevent a bad problem getting worse. So some people will preemptively do this surgery, particularly if we've had a dog who's survived 2 or 3 bloats just through tube management, and we're thinking, this guy is at high risk. I think it is a reasonable thing to do when he's well. We do it as a preventative strategy. But other than that, there is an element of it's in the lap of the gods. So just be aware, if it's a large breed dog, and it can happen any hour of the day, but classically some terribly unchristian hour, and they're mooing like a cow, and they're desperately trying to vomit, and their belly's looking inflamed, run, don't walk. These dogs don't keep. They will die from cardiovascular shock if it's a bloat and it's progressing. So don't live in fear. I don't think there's any point in anyone living in fear all the time, but just be cognizant, be aware, and when in doubt, get in touch. And if either you or your vet are still in doubt, take an X-ray. That will tell you yes or no, and then we address it. So hopefully that was informative. Give you something to apply to your own dogs. Thank you again for tuning in to the Nico the Vet channel, and thank you as always to everybody who sent their very sort of kind comments and ideas for future talks. So if anyone's got any thoughts, any ideas, please share them with me. Otherwise, stay safe. Thank you. Bye-bye.